Good afternoon, everyone. Welcome to this webinar on what agricultural producers, agricultural businesses need to know about wildfire smoke. My name is Whitney Pennington. I am the outreach lead at the High Plains Intermountain Center for Agricultural Health and Safety, which is based at Colorado State University, and I'm happy to present this webinar today in partnership with Engagement and Extension at Colorado State University. I am excited to introduce you to our three speakers for today. First, we will have Dr. Channing Bice from the Communications and Outreach Specialist of Wildfire Smoke Preparedness Program at the Colorado Department of Public Health and Environment. Dr. Bice will be our primary speaker today and will be covering best practices to protect ag worker health from wildfire smoke. Then, after Dr. Bice, we'll have Eric Yohe, the manager for Labor Standards Outreach and Legislation from the Colorado Department of Labor and Employment. He will be speaking to the overlap between wildfire smoke and Colorado's ag heat rule. And finally, we'll close out hearing from Ruben Pacheco from the Agricultural Workers Services Coordinator from the Colorado Department of Agriculture. Over the course of this webinar, you may enter questions or comments using both the chat feature or the Q&A feature from your Zoom window bar. Those may be entered, your comments and questions may be entered in English or Spanish, and those will be seen by only by us speakers and the interpreter. We do plan to dedicate time at the end of this session for that Q&A. All right, and so now I am going to pass things off to Channing Bice.
Great. Awesome. All right. Wonderful. Okay. Well, welcome and thank you for being here. My name is Channing Bice and I am the Communication and Outreach Specialist with the Wildfire Smoke Preparedness Program at the Colorado Department of Public Health and Environment. So my goal really is to leave you all with sort of a clear, practical sense as to why wildfire smoke is a health problem, what it means for you and your workers, and what you can do to protect yourself and your workers without having to shut down your operation when wildfire smoke hits. So here is a roadmap for my presentation today. I'm looking to essentially answer 5 overarching questions in order. Those questions include why act now when wildfires aren't new, how smoke actually affects health, why agricultural workers face higher risk than the general public, how to tell when smoke is bad enough to act, and the part that is really key, I'm sure, as to why you're all here, what you can do to protect workers in a way that's realistic for your operations needs. All right, so the first question we'll start with, wildfires have always been a threat. Why act now, or why does this matter now? So wildfires have always been a part of life in the West. So really a fair question is, why are we concerned with this now? Of course, we don't have to look too far for this answer, as we've definitely been living it this summer, especially with the 4 major wildfires that broke out in late June, Aspen Acres, Ferris, Willow, Gold Mountain fires, that I'm sure many of you have probably heard of on the news. And of course, we're getting new small wildfires that are popping up every day. So a big part of that why, we just came out of course, one of our lowest snowpacks on record this past winter, which left us more vulnerable than we usually are. So really, this isn't as much of a hypothetical. It's kind of what's happening now. and what's happened over the course of this past summer so far. So this wildfire season is really a snapshot of four bigger shifts. So first, fires are, of course, becoming more frequent and larger, and seasons are running longer across the Western United States and Canada. Second, smoke really travels, so you don't need a fire right outside of your community to be impacted by smoke because that smoke is transported from long distances. For example, we've seen some smoke that's come from Canada and that's come from other states as well. And it really hits people who are more biologically susceptible or socially vulnerable that are kind of hit the hardest by this. So we'll talk about sort of what those terms mean later on in this presentation. Third, of course, as Colorado's population keeps growing, we keep expanding and living in the wildland-urban interface. So residents are more exposed than they were in the past. And finally, of course, hotter, drier conditions stretch the season out and are making it more intense as we're seeing. So none of this is going away anytime soon, which is why sort of building in smoke readiness planning for your workers rather than treating each smoke event as a surprise can really pay off. All right, so moving into our second question, how does wildfire smoke actually impact our health? To get started, wildfire smoke isn't just one thing. It's really important to remember that it's a mixture of gases and tiny particles, and what's in it is really going to depend on two factors. So the first being what was burned, and that can often range from vegetation, homes and buildings, unfortunately, vehicles, different types of plastics, poles, metals, things like that. And then, that second key factor is sort of how it burned. So whether it was smoldering, whether it's heavy flames, and between those things can kind of determine what that mix looks like. So out of everything in that mixture, we really are looking at what's called particulate matter, or PM, which is the main way that we measure how much smoke is in the air and how it's affecting our health. So that's where our next focus will be. So a quick introduction to particulate matter. In terms of a definition, you can really think of it as solids and liquids that are suspended in the air and sorted by different size fractions. So we have PM10, which is our coarse or thoracic size, and that's going to be things like dust. We have PM2.5, known as fine particulate matter. That's the common size of wildfire smoke pollutants and what we're most concerned about in this context. And of course, we have PM.1, which are ultrafine. So I do, just to kind of put this into perspective, want to sort of guide your attention to the left-hand side of the screen. I really love sharing this graphic because it puts into context just how tiny these particles are. So here we have, of course, a piece of human hair and fine beach sand. PM2.5 is essentially within this PM10 dot in these little three lines over here. So very, very small, and it can't always be seen or smelled. So I bring that to your attention because so often we rely on sight and smell when determining wildfire smoke risk, but even at unhealthy levels, we can't always see it or smell it. So it's really important to be monitoring the air quality instead of just solely relying on our senses, which we will also visit here in a little bit. So the health effects of wildfire smoke exposure fall into two buckets. Acute effects are what workers are going to feel right away. That can be irritated eyes, nose, and throat, wheezing, coughing, chest pain, trouble breathing, headaches, and fatigue. Chronic risk is really from that repeated exposure over time to wildfire smoke. So, of course, smoke can worsen existing disease that people might already have, including asthma, bronchitis, and other lung disease. And it's also raises the risk of heart attack, heart failure, and stroke. And over the long run, that repeated exposure increases the risk of developing asthma if you don't already have it, and respiratory disease, cardiovascular disease, cancer, and premature death. So that's why it's really important to not just keep in mind those acute effects and being able to recognize them right away, but that long-term piece and thinking about how workers are repeatedly exposed over time and that risk that it's presenting to them. So our next question, why are agricultural workers at higher risk? So anyone can be affected by wildfire smoke, but that risk isn't really shared equally, and agricultural or outdoor workers are often carrying factors from both columns on this slide. So if this looks familiar, these are sort of the biologically more susceptible factors and socially more vulnerable factors that I had mentioned earlier. So starting on the left-hand side is biological susceptibility, the same exposure that produces worse outcomes. So that's really going to fall into categories such as older adults, children and teens, pregnant and postpartum workers, and anyone with pre-existing conditions like asthma, COPD, heart disease, high blood pressure, or diabetes. And then moving to the right-hand side is social vulnerability. So this is where the same smoke event leads to more exposure and then worse outcomes. So outdoor and agricultural workers are outside for 8, 10, 12, or even more hours per day. And even indoor tasks on your operation may be happening in spaces that aren't well ventilated or filtered. And then layer that on with the limits to healthcare access that many people can face. And of course, language barriers that may keep safety information from reaching everyone, and lower socioeconomic status. And it's worth keeping in mind sort of which of your workers deal with more than just being an outdoor worker, outdoor agricultural worker. Some of your workers may fall into both of these categories or deal with more than one of these factors on either side, and that really compounds their risk. So it's important to really think about your workers and some of the risk factors that they are facing. All right, so how do you actually know when smoke is bad enough to take action? So this is where the air quality index comes in, also known as the AQI. The AQI takes several pollutants, including particulate matter, which we just talked about, ozone, carbon monoxide, sulfur dioxide, and nitrogen dioxide into account and translates them into one health relevant scale. It runs from good to moderate to unhealthy for sensitive groups, unhealthy, which is unhealthy for everyone, very unhealthy up to hazardous, and it's color coded so it's easy to read at a glance. A couple of useful details. The AQI can tell you which pollutant is driving the value. So here in a moment, I'll show you kind of where you can look for that. But you can find single pollutant AQIs, so you can tell whether particulate matter is driving AQI, if ozone is driving it on some reports. During a smoke event, of course, like we talked about, PM 2.5 is usually that key driver. If you're interested in learning more about the AQI and going in depth, the QR code and link here offer a full breakdown and plain language explanation for what each category means, who's at risk, and some actions that can be taken. And then, as a preface, the slides that follow offer some of our recommendations for reliable air quality information sources to check the current or forecasted air quality for your area. So as I go through these, I want you to keep in mind that you're not required to use every single resource. Definitely choose what you like best and what works for your operation and the ways that you prefer to receive your information. So you can first and foremost check the air quality by inputting your zip code into airnow.gov. This is really the main tool for checking your air quality. It's free, is on a website, and you can also have it as a mobile app if you prefer to have it on the go. And then from there, you can get a nowcast and reading and a forecast. So you can look at historic trends by month, week, or day, which can be useful in the middle of an event to see whether things are sort of upticking or clearing up. And there's kind of a map view that can give you a broader sense of what's happening in the area. So as I had mentioned in the previous slide, you can find that primary pollutant that's driving air quality right here, sort of under the AQI dial on the airnow.gov website. This is where you can click the bars to see some different historical trends. And there was that map that I was talking about as well. So this is kind of what it looks like here. And then another great tool is AirNow's Fire and Smoke Map. So you can visit fire.airnow.gov. And this one's really helpful because during a smoke event, air quality can really vary greatly across a geographic area. So the AQI map can show you real-time and historic PM 2.5 levels, and it's color-coded by AQI where there are air quality monitors. And of course, you can also see the smoke plumes as well. So this is an example from a wildfire smoke event back in March that was burning in Nebraska. This is not happening right now, so I do want to preface that. But this is kind of what it looks like and how you can tell where that smoke is coming from. The third resource is the Colorado Smoke Blog, and I've provided the link here, but this is written by CDPHE's smoke forecasting and meteorology team. And it focuses more specifically on local Colorado smoke impacts. And they explain when smoke is expected to clear or worsen or what's causing it. And then if trying to remember to manually check the air quality on top of everything else you probably have to do, it might be worth considering turning on or signing up for air quality alerts. So first on the left-hand side is the AirNow mobile app where you can download it. So you can download it for free on the Apple App Store or Google Play. And then to turn on notifications in that app for specific AQI thresholds that you're concerned about, you can just open the menu. So it'll be a button that looks somewhat like this. And it should be in the top left-hand corner of the mobile app. And then you'll go from there to select notifications, and you can set push alerts for your chosen locations at certain air quality thresholds. So I know mine personally, I have set to go off at unhealthy for sensitive groups and above. But that's totally your preference, and that totally depends on workers that you may have who are at risk. And then there's also CDPHE's air quality email alerts. So here you can basically sign up to get advisories delivered straight to your email inbox. I've included QR codes on here. I'm also more than happy to share these slides afterward. But this is the link where you could go to sign up, or feel free to scan the QR code as well. So now to the question that really matters most for your operation. What can you do to protect workers without hurting your operations bottom line? So I want to start off by recognizing the landscape of state and federal air quality index action standards. Essentially, there's no single number or air quality index specific threshold where action becomes mandatory everywhere. So what we have are NIOSH recommendations, and there are some Western states who, in the absence of those the lack of federal rules, I should say, have created their own rules. So NIOSH's recommendation scale, I've included here sort of alongside the AQI to help make that a little easier to visualize and see, but at 100 or below for the air quality index, it's a good idea to prepare your crew, train them on air quality related health effects, how to check it, and actions to take, and monitor your crew for symptoms. And of course, keep an eye on the AQI. And then from 101 to 150, that's going to be our unhealthy for sensitive groups category there. And you'll want to be sure to protect your sensitive workers and offer some respirators for voluntary use. At 151 and above, so that is going to be the unhealthy for everyone category, it's worthwhile to make respirators available to all and possibly consider stopping outdoor work. And then sort of scaling down to just the state of Colorado specifically, we do have one rule to keep in mind, which is 7 CCR 1103-15, an agriculture labor conditions rule. So when a CDPHE air quality advisory or action day is in effect, employers must give at least 10 minutes of rest for every 2 hours of work. And just to revisit those email alerts, I fully realize what I said about doing or seeking information that makes the most sense for you. But I would highly recommend CDPHE's air quality email alerts, because it would be especially helpful for knowing exactly when those advisories go out, because the rest requirements are based on those advisories. So it may be worthwhile to really consider that. And again, I have the link available here and the QR code as well if you would like to sign up for those. All right, so with those rules in mind, and to make things a bit more manageable, I want to give you at least a framework to help remember as you're dealing with smoke. It's essentially called the RACE Occupational Health Management Framework. It stands for Recognize, Assess, Control, and Evaluate. So recognize means knowing that there's a risk, so staying aware of fire and smoke events and knowing the symptoms of acute exposure. And then assess means looking at really the specific day. So taking a minute to look at the air quality and smoke forecast for your area, think about your at-risk workers, and think about what work tasks are planned. C is control, so taking active steps to reduce exposures for your team. Evaluate is E, so At this point, you'll want to check effectiveness of your control measures to see how workers are doing. And of course, air quality can change so quickly that it's really worthwhile to evaluate and adjust as necessary. So how do you actually do these things? So starting with recognizing the risk, of course, you being here today is really a great first step toward that recognize or that R in this framework. So of course, knowing when there's a risk, learning the symptoms of smoke exposure, especially the acute effects, so you can spot them early and help get your workers out of the smoke as soon as possible. And then, of course, consider signing up for air quality alerts or downloading the AirNow mobile app and turning on notifications. Moving on to A for assess. This is where you're really trying to match the day to your crew. So here it's important, again, to know which of your workers are at higher risk. Review the planned tasks for the day. Maybe think about which tasks can move, be shortened, or wait until air quality improves, or think about the level of strenuous activity as well. And maybe for those lower strenuous activities, think about putting your more sensitive workers on those, things like that. And then, of course, again, checking the AQI, so your current and forecasted air quality conditions, so that you can plan ahead instead of react. C, control, is really kind of at the heart of it. And there is a bit of a rough order to this. So first, try to provide cleaner air break areas where you can. This involves closing windows, setting the air conditioning to recirculate, and using portable air cleaners so your workers have somewhere to recover for a bit. Second, you can, of course, stay out of the smoke altogether. So that can include pausing work or moving tasks indoors as possible. Third, adjusting the work itself. So thinking about shortening shifts, rotating those high exposure tasks, and allowing more frequent breaks. And of course, assigning lower intensity work when the air is bad. And when exposure just genuinely cannot be avoided, offer N95 respirators, but it's important to sort of watch for heat stress with that, because respirators and hot conditions together bring their own type of risk. So really prioritize that piece of reducing exposure first, maybe before moving into that protective equipment. Finally, E for evaluate. So this is going to close the loop, reassess, and evaluate often, just because air quality and the symptoms that you experience can change pretty quickly. After an event, debrief with your crew and talk about what worked, what didn't work, and what you should think about doing differently. Think about updating your smoke preparedness plan and retraining workers sort of based on your debrief or what you learned. And finally, it may be worth considering low-cost on-site air quality monitors, which can give you readings specific to your location and better inform your response. So that is the overarching acronym and tools that you can take moving forward. And then before we finish, I want to point to a new one-page field reference that we've built. It really pulls everything we've covered today into a single front and back sheet. So the things including smoke symptoms, when to seek care, checking the AQI, the race recommendations, and the NIOSH recommendations are all available on this. And we have it available in both English and Spanish as well. So feel free to download it, print it, or post it in break areas, share it with your crew leads, share widely. So thank you very much for your time and willingness to take wildfire smoke seriously to protect yourself and your workers. I will hand it over to Whitney. I'm not sure what question pacing and everything looks like, but yeah.
Thank you, Channing. We do have a few moments. So this is a reminder that you can put questions or comments in either the chat and send them to us all, or you can put them in the Q&A. While we give people that time, I would love to have Eric go ahead and get ready for his section. And as you were speaking, I put in a bunch of your links in the chat, so folks have those live now. And then I also have copies of that document, and we can send that out as a follow-up. So everyone who is on and who registered can get all of those links direct to their email. Okay, so I am not seeing any questions at the moment, which is fine, but you have um, the chat and Q&A are still open, so anyone is welcome to put in those questions as they come to you. And next, I would love to pass things over to Eric Yohe from the Colorado Department of Labor and Employment.
I'm going to put in the chat a link to my division, DLSS, creates these great public guidance materials that we call infos. And I won't go through what the acronym actually stands for, but I'm going to work off of one of those today. And I'm going to go ahead and put a link to it in the chat. And I'm going to talk about two basic issues. The rules that have been written that define what we called increased risk conditions when we're talking about heat safety. And when we do identify, or when an employer does identify the increased conditions, I will also be talking about what is required of employers if on any given day when your folks are working, you go into that increased risk conditions category. So I'm going to start here with what the actual risk conditions are. And in addition to 80-degree temperature, there would be one or more of the following for this to be increased conditions. Thank you. If any of these conditions are in play, then employers must take additional precautions. So, as it says, high heat, which means the daily high forecast or worksite temperature is at least 95 degrees. There's unhealthy air quality. The way our info and rules state is that CDPHE has issued an air quality advisory or action day. I think this information is still up to date, but that language is still up to date. But after listening to the presentation, I may see if we need to change the language just a little bit, but not what the employer is required to do. If a long workday is reasonably expected, over the last few years, we haven't seen agricultural workers work over 12 hours in a workday or shift. because of some regulations that went into play a few years ago. This long workday does not apply to a range worker, someone who's getting paid at an AWAR rate for a range worker. Okay. If heavy clothing or gear is required, that is also an increased risk conditions. And if an employee needs to be acclimatized, then that is a risk issue for that first 4 work days when the temperature is over 80 degrees for the employer, which includes the first 4 work days for the employer and over a month. So if any given day we have the increased conditions, let's see, the additional precautions that must be provided in addition to the basic heat precautions, the employer must provide 10 minutes of an extra, or wait, excuse me, not perform more than 2 hours of work before at least 10 minutes of rest are provided. This can be done by spacing out breaks or any way you want to do it, but they can never perform more than 2 hours of work before getting 10 minutes of rest. Okay. There must be provided a notice of rights, which is pretty straightforward, of what an employer must do and what protections must be provided. And this includes adequate drinking water and adequate shade, especially during rest, meal, and other breaks. The additional breaks, as I described above. And we kind of hit the nail on the head, just keep pushing it. We have to make sure no employees perform no more than 2 hours of work before at least 10 minutes of rest are provided. That's in that provided notice of rights. Those are really what is required if a certain day meets that increased risk. It's what needs to be provided is pretty straightforward. It's not a big lift on top of what needs to be provided, precautions that need to be provided in any day over 80 degrees. So I think that's all I have. Thanks for having me, Whitney. If you have any question, please let me know. I apologize. I used to do these like every 6 months or so, and this was new to me. I had to reread everything today to remember these because I haven't been in the ag piece for quite some time. But I think this information, and if you do click on the link or find the information to this info number 12C, it's pretty straightforward information that can help you with making sure to protect your workers.
Great. Thank you, Eric. I am having a computer issue of my own right now, so I'm going to go ahead and pass it off to Ruben while I sort things out on my end so that I can see the chat and the questions when they come in. So Ruben, we'll go ahead and pass off to you.
Good afternoon, everyone. I don't have any slides today. I will just be giving a report on some of the supplies that we distributed. But today I'm filling in for our program manager, Aldo Parra, who's unfortunately couldn't be here. About 2 weeks ago, as wildfire smoke began impacting agriculture communities across Colorado, Aldo took the initiative to bring together agencies that serve agriculture workers to identify the most urgent needs. and coordinate a response. Through those conversations, the most requested items were N95 masks, eye drops, saline nasal spray for smoke-related congestion, and bandanas or gator masks. Many of these supplies are also helpful for workers dealing with extreme heat conditions. The supplies were made possible through several partnerships. Emergency funding from the Colorado Department of Agriculture allowed us to purchase 600 bottles of eye drops and 1,000 gator masks. Elizabeth Velasco and her office generously donated saline nasal spray and KN95 masks. HICAHS also provided bandanas with Orbeez inside, which hold water, N95 masks, and an excellent comic literature to help educate workers about wildfire smoke and heat safety. The materials distributed to two primary regions. At the time, with the current fires that we had 2 to 3 weeks ago, the Western Slope and the Pueblo area, which was impacted by the Aspen Acres fire. In Pueblo, supplies were distributed through the workforce centers where they were quickly provided to employers and no longer at the workforce centers. However, the Rocky Mountain Sur Empowerment Center still has supplies available in Pueblo and will be distributing them during their event this Sunday from 3 to 6 p.m. They will also have ribs and food, and we'll give $50 to the first or to all ag workers that come. For the Western Slope, La Plaza held a health fair July 16th, where they distributed the majority of their supplies to agriculture workers, leaving only a limited amount remaining. Also, program partners like Migrant Education Program have helped disperse resources in Palisade, Mesa County area. At the Delta County Workforce Center, we still have most of our supplies there due to the changes in local agriculture conditions, including reduced corn planting this year and crop losses in the North Fork area from the peach freeze. As workers have remained in the area, we've been incorporating these supplies into our heat illness prevention trainings, providing masks, eye drops, and other protective materials alongside the education. Some of the remaining supplies we also have available are going to go to the agricultural picnic in Center, Colorado. Likewise, it's still Sunday, August 2nd from 3 to 5. So if you know of any agriculture worker or employer who could benefit from these supplies, please let us know. I do believe Whitney has mentioned that they also have resources that they can give out, some more funding for more resources. But yeah, we'd be happy to connect them with any of these distribution locations or upcoming events. Thank you.
Thanks, Ruben. I tried to catch those dates and put them in the chat. But if you don't mind double checking that I have gotten that correct, if that would be great.
You got them all, Whitney.
Nice.
Yeah, and so most of those events they're going to be this Sunday. So one in Center, Colorado, and then it's going to be at their local park, their only park. And then at Pueblo, it's going to be at the Empowerment Center for Rocky Mountain Sur. And so from 3 to 6, they'll have food. It'll be a really good time. So plus they can get all these cool supplies.
Awesome. Thank you. At this time, I wanted to open it back up to see if we have any more questions. I am not seeing any questions in either the Q&A or the chat box, but I do have a question for Channing, and this is a hard question, so I'm sorry. But I wonder if you have any thoughts, and I don't know if Eric might have any either from the CDLE perspective, but you mentioned several times adapting and adaptations for sensitive workers, and what might the process look like for an employer to understand who might be at higher risk without forcing anyone to disclose any disabilities?
That's a fantastic question. I think really, and I'm also happy to seek the advice of my colleagues as well, but I think at the heart of it is really being able to foster a culture of safety within your organization and just fostering good relationships with your workers. So not necessarily coming out and maybe asking right away, but just like getting to know your workers. Even just questions like, hey, how are you doing with the smoke can really go a long way in maybe sort of uncovering that without being intrusive. And just being like, hey, are there any resources that you might need or anything like that? But really just fostering a culture on your operation where workers feel that they can come to you with a concern without fear of reprisal, I would say is probably like the best first step there. Of course, I'm happy to consult with my colleagues when they return from being out of office, but that would be my key recommendation.
Thank you for that.
Yes, can you hear me okay?
Yes, I hear you.
Okay, I'm so sorry. I'm trying to put this in the chat. It's not working for me.
Okay.
I just wanted to just wanted to chime in to let anybody know that I know we talked about the upcoming events that are going on with the Agriculture Appreciation Picnic. Our mobile vaccine team will also be available for anybody that's looking for the Tdap, which is the tetanus shots. They're free. So I was trying to get our website in there too, so you can see if you haven't seen our flyers or want to know where clinic is. If you have to send anybody to responding back to the fires too, we're there with our free vaccines as well. So we will be in the upcoming ones. We're going to be there 8 2nd at the SLV Agriculture Appreciation Barbecue, and then also will be at the District 60 Pueblo District 60 Back to School bash event at Dutch Clark Stadium that are coming up on 8/6 of next week. So if anybody's looking for, if any, you know of anybody that needs vaccines or looking for tetanus and regarding to the fires too, please send them our way and we can get them taken care of. Thank you.
Thanks, Christy Ray. So opportunities not only coming up for you or your employees to get fire smoke reduction resources like N95s, cooling bandanas, but also the opportunity to get some more wraparound health services. Thank you for all of our partners who work on that. Okay. So we are right at the end of our time. I want to say thank you so much for attending today. Thank you to our speakers for contributing their expertise, talking through their resources. I am going to put one more resource for you in the chat, which is our HICAHS, High Plains Intermountain Center for Agricultural Health and Safety. We have a page on our website that recaps a lot of the information shared here today and information for how to protect outdoor workers from smoke. That website is available in English and Spanish. Thank you so much. Stay safe and have a great rest of your day.